Hello, my name is Dr. Ganan. I'm a physician here at Virginia Integrative Health, and today I wanted to talk to you about trigger point injections. Trigger points are defined basically as areas of muscle which have chronically become too tight, have actually sort of been flexing too much, and over time, because of that excess flexion or tension in the muscle, have built up a significant degree of inflammatory chemicals, and as a result, the muscle really doesn't release and can cause pain. So if you think of any kind of material, if you just think about the sheet on your bed, right? If you were to go up to the sheet on your bed and grab it like this, all of the sheet surrounding that grab, you would move it, right? So, and the muscle is the same way. Many times people will think, well, you know, I've got pain up here. What would it matter if I have a trigger point down here? And everything is connected. So just like on that sheet, if I grab, the whole sheet moves all the way from the edge of the bed. Your muscles are the same way. So people can have fairly significant pain in their back in one area, and it can be because of tension in trigger points in a completely different area of the back, because all of those muscles are interconnected. So at Virginia Integrative Health, part of what we do when people have pain issues is we evaluate their back. We look at the biomechanics. Between myself and our chiropractor, we're going to evaluate the alignment and the musculature of your back and see, do you have trigger points? Are those trigger points present and an issue for you? And if we find trigger points, we like to inject those with a combination of Serapin, which is a natural plant extract, which I've covered in another video, and a little bit of an analgesic or an anesthetic, such as lidocaine or marcaine. And what happens when we inject those trigger points, actually the combination of the mechanical entry of the needle into that tightened trigger point can relax the tension, and also the presence of pushing in the liquid and its analgesic effect can spread the muscle out. So instead of the muscle chronically being like this, as soon as we are able to break that tension and release some of the adhesion in the muscle is finally able to relax. And so when you treat those trigger points, you can see a vast improvement in pain, not just in that area, but in other areas in the back that may have been pulled off alignment because of the chronic tension of that trigger point. So trigger points, definitely injecting them can make a significant difference for people with pain, not just in the back, but in other areas, because anytime your back is out of alignment, everything in the body is affected. All of your biomechanics are affected. So this is something we do for just about any pain patient that comes in. We look to see if trigger points are an issue. Sometimes people can see significant improvement in their pain issues after just a couple injections. Usually we try to do at least 1 to 2 injections of trigger points a week. And some people may only need a few injections. Some people may need 10, 12, sometimes more, depending on how long have those trigger points been there? How long has their pain been an issue? What is their external environment like? When they leave here, do they go back to a very, very stressful environment at work or at home that causes them to have increased tension and brings those trigger points back? So as with everything in medicine, there's not just one factor that we're looking at, and everybody can respond differently, but doing trigger point injections can definitely make a significant and a long-term impact in a positive way on people's pain issues. If you'd like to learn more, you can visit our website at virginiaintegrativehealth.com or give us a call and come in for a consultation.